Hi everyone. Hope everyone's doing well, and if you're in Melbourne, coping with the weird and wonderful Melbourne summer weather. For those that don't live in Melbourne, we have like 3 or 4 days of like 30, then it gets to like almost 40 degrees, and then we get a tropical cyclone and thunderstorms and all sorts of weird and wonderful things. So it's if it's 28 degrees steadily, it's a nice day, but when it gets ridiculous, it's ridiculous. Okay, so this topic is about me and my first day on ADHD meds. Wow, that is literally, I will try and keep this under 10 minutes. I also have the neighbour's birds squawking next door because we do leave our back door open for the animals. So yeah, apologise for that. I'll try and get through it without that distraction. So the whole reason firstly, disclosure, this is about me. This is not for anybody else. This is not medical advice, and this is not suggesting you go on ADHD medication if you believe you're ADHD or have a formal diagnosis. So please, this is not advice. So this all came about due to the ridiculous amount of pain that I've been in and was in for like a year or still in, but like a year and a half to where this occurred. And I was getting ready to go overseas last year, and I was sitting in my hairdresser's chair reading my Apple News, and an article came on which talked about someone doing research, and I'm pretty sure it's America, but I think Asia as well. A couple of other places where they were doing research on the link or connection between ADHD and chronic pain. And they actually named myalgia, encephalitis, chronic fatigue syndrome, specifically with ADHD. I can't remember if they mentioned fibromyalgia, but I think they did. And I've had myalgia, encephalitis, chronic fatigue syndrome. I was diagnosed when I was 21, so pretty much 30 years. But I'd never been diagnosed ADHD. And obviously there's been a lot of education, especially probably in the last 5 years. There's been a lot of booming medical understanding of how ADHD presents differently in girls, women, why so many women were missed. Like, I was born in the 70s, so I wouldn't have even been acknowledged. And then even when I got my autistic diagnosis, it was touch and go whether they were diagnosed with both, because the therapist told me that only 10 years ago, if you presented stronger with one than the other, they would only diagnose you with the one, not the both. But now they're accepting that people can have both and understanding that better, and especially women. So I'm talking about women, not talking about boys. So we do present differently. We sit still, but our brains are busy. I pick my fingers, I scratch. Someone else I know is twiddle with their hair and pulls at it. They might not look like to you that it's a hyperactive thing, but it actually is, because it's trying to just stop the noise in our heads. So I want to explain what I refer to as the noise in my head with regards to ADHD. Someone said it's like having a mountain of internet tabs open, like on your computer. I don't like that analogy because I don't actually relate to that. And maybe it's because I've got both. I'm both autistic and ADHD. Maybe it's a little bit different. But basically, my husband actually said a really good analogy the other day, which I really, really like, and I hope I remember it. It's like a bunch of TV channels open and my brain hasn't decided which one to settle on. So it's like I might need to remind myself to do something, so that'll be in there. I might need to do something like call, so that'll be in there. It might be I need to take a bath, that'll be in there. It might be just, did we look up that fact from that movie yesterday? That'll be in there. So, all of it's spinning. It's like on rotate, and that's most likely why the forgetfulness is there, because it's on rotate, and then it's like, so one of the things the psychiatrist has asked me when I saw him on Saturday was, from the psychologist, it's like you put a lot of things in place to manage. And I'm like, yes, I screenshot everything. I screenshot appointments. I screenshot, like when we're traveling, which we're traveling again in May, and I've screenshotted all of that, because if I don't, I won't remember and I won't have the details. And I know most people with something like an airplane would probably keep some kind of record on it, or maybe just rely on their email, but I don't. I just screenshot everything. But I also will then look at it every day for a week leading up to the trip. So yesterday, I took my first tablet in the morning, and I still got up late. Like, it's not, a perfect fix. I still got up late because I'm still struggling to sleep, and I'm still in pain, and my back's still, doing its thing. So it's yeah. But I was able to make a phone call, take a shower, and tidy the bathroom, all within a space of like an hour and a half. And for the way that I have been feeling the last 6 months to a year, I have no mental energy. I haven't even had any mental energy up until yesterday. I'm just like a blanket of exhaustion, but my head and my body are separated with their exhaustion. It's actually 2 different types of exhaustion, and only one doctor's been able to understand that. And please don't ask me to explain, because I really, really can't. It's like the body's the pain, although the pain is reaching to my head, but the head is a separate exhaustion to the body. So it can be really, really, so that's why I say it's a blanket of exhaustion. It's just, it overcomes me like a wave, like a sea wave. It just overcomes me. But I've been living like that for at least the last 3 months. Can't physically do anything, can't mentally do anything. The executive dysfunction has been very, very severe. So yesterday, being able to do that within an hour and a half, I was like, oh wow. Then I had a cereal, I watched a movie. Please watch The Beekeeper if you haven't already. And everyone should be sitting down with their mothers, their grandmothers, the vulnerable, anyone who doesn't understand how IT works. Please, 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 please. I cannot stress enough what this movie goes into. Yes, it's got Jason Statham and it's a bit of revenge, and but close your eyes or look away. But watch this movie, The Beekeeper. Anyway, so then after that movie, I did the dishes. I put dishes away. I did laundry. I swept the floors. And when I say I swept the floors, my floors have not been touched in any shape or form, vacuum swept or mopped. Because my husband's like really, really flat out at work, and because of my executive dysfunction, and it's just like too overwhelming, I haven't been able to get to it. We're not unclean people, and we're not untidy people, and thank God we have tiles. But it's just too much for me at the moment. And we did have a cleaner, but I don't have one anymore that I can reach out to. So I did that all in one day. And today I've hung out washing, I've made a phone call, and I'm doing this video. And it's not focus per se, it's not even clarity. That the medication has given me relief. I still have a bit of noise in my head because I'm only on the lowest dose at the moment. I'll increase it next week, and that'll be interesting. So it's just, yeah, it worked, and it was like a grief moment, an angry moment, a sad moment. But like I said, I spoke to my brother, and I know that with my generation, it was definitely not something that was going to be picked up, especially in girls. So that's okay. The autistic thing is another thing. But like I said, I could have been diagnosed in my 30s and then got the autistic diagnosis later. I could have done it the other way around. And then at least I might have had meds to help me, but, it still wouldn't have been perfect. So if you are on that path and that journey, please keep going, because there are good medical people out there, and I'm very, very fortunate that my GP is open to listening to me and reading what I send him. And I'm just going to quickly talk about the pain because we're nearly over 10 minutes. When I took my tablet yesterday morning, my back was at a point where it was going to be really bad. Within 2 hours of taking the first tablet, my back pain had stabilized to the point that I could do what I did yesterday. Then after I swept the floor, my back pain flared again to a point where I'm going to be knocked out for a couple of days because that's not normally what it means. And again, within 2 hours, my back pain stabilized. So maybe there is this thing, but just because you've got chronic pain doesn't mean you've got ADHD, and just because you've got ADHD doesn't mean you've got chronic pain. So there are questionnaires online that you can answer, and if you do answer, if they do come out in your favor that you have some type, like a mild to severe ADHD, then go to your medical professional and push them for that, man or woman, but also saying that, as I said, this is about me and no advice. The medication has so far, even the little amount that I've taken has worked for me. Doesn't mean it will work for you or everyone else, because we're all different. We all have our own individual chemistry makeup. But I just want to say I'm a little bit blown away, and I literally wanted to scream it from the hilltops what a difference it made. I wasn't hyper. I was a little bit when I spoke to my brother. I wasn't manic. I didn't do more than what I could do. So when my children were little and I would obviously have to take care of the house, I did it in bits. So I'd do a little bit in the morning, then rest, then a little bit, and then rest, and then a little bit. And then when they got home, try and ask them to get involved. So that's how I worked when I was a younger mum anyway. So I'm going back to what I used to do. And I haven't been able to do that in over 2 years. So, I just wanted to, like I said, shout it from the rooftops. And I do apologise, I've gone over 10 minutes, but I hope you've been able to listen and stay true. Yes, people will say there's natural remedies out there. I'm a mature older woman. I've been through a lot, and I'm at the stage where I just need relief, which this has given me. So thank you for listening. Hope you have a good week. Hope you're able to cool down if you're in Melbourne, and anywhere else in Australia, because it's hot all over. Have a good day. Thank you for listening. Thank you for following, and share around, and watch The Beekeeper. Bye.